Hi, good afternoon, everyone. Thank you so much for joining us today about this important topic around access to care. My name is Carolyn Ingram. I'm the health plan president of Molina Healthcare of New Mexico, and I'm really excited that you all have taken some time out of your day to put some attention to this very important topic. In addition to leading the health plan in New Mexico, I also am the executive director of our Molina Healthcare Charitable Foundation, the sponsor of today's event. One of the things that we try to do at the foundation is make sure that we're sharing exciting new programs across states and nationally that are going on. And part of that we do with our commitment back to states through a program we call the Molina Cares Accord, and really trying to look at how we invest in communities, share information that's going on across states, and making sure that we're able to take the learnings from those good programs and share them out nationally. And so today's topic is very near and dear, of course, to my heart. As many of you know who are joining, I'm from New Mexico. I grew up here, raised my kids here, and have seen firsthand, both in dealing with my personal issues with some things that have gone on with my family, but also just in helping to serve New Mexicans, a lot of the health disparities that we have across the state, and a lot of the issues that we have in terms of trying to really access care and appropriate treatment for services ranging from physical health things that we need to prenatal care and especially behavioral health. And so I'm really excited today to have some of our speakers on to talk about the programs that they're leading across the state, how they've really overcome some of the barriers that are out there, which could be anything from really provider coverage, as many of us have encountered, to linguistic barriers or social economic barriers that really affect people. In order to try to make some change around that, we are investing some dollars towards programs to try to increase access to care in New Mexico. And the Molina Cares Accord has made it a commitment of $400,000 to help improve access to care in a program that we call Molina Cares for Families, or Molina Cares para Familias. And so you're going to hear a little bit more today from some of the grantees about the initiatives that they're working on to try to improve access to care in New Mexico. Before we dive into that, though, I want to introduce Senator Ortiz-Ipino. He's with us here today. So Senator Ortiz, I'll ask you to go ahead and turn your video camera on. So Senator Ortiz-Ipino has worked, as many of you all know, tirelessly in our legislature trying to help on this very topic. He represents the 12th district and has for the last few sessions been chairing the Health and Public Affairs Committee on the Senate side, but has just a wealth of experience, obviously, in New Mexico in terms of working on and tackling these issues. So we asked if he would kick things off and be our keynote speaker today. So Senator, I'll turn it over to you and have you get our conversation started.
Well, thank you very much, Carolyn. This is very interesting, and I'm looking forward to listening to the panelists. First, I thought I'd share with you what we discovered this summer during our interim committee hearings around the state. We held hearings. This is the Legislative Health and Human Services Committee, made up of House members and Senate members. And we held hearings, as we do every interim period between the sessions. This year we held them in Taos, we held them in Gallup, Las Cruces, Santa Fe, and Albuquerque. And what I'd like to share with you is just some of the things that we ran into as we went around the state. First, we made it a priority to always, at every location, to talk about the whole situation regarding behavioral health, because that, during the COVID pandemic, has become one of the major concerns that we have in our state. So many people have not been able to access care during this time. It contributes to the homeless situation. It contributes to our physical health problems as well. A recent series of articles on alcohol-related deaths point out that we lead the country in the number of deaths, not in the number, but in the percentage of the deaths in our state that are related to alcohol consumption. And that goes beyond DWI. That includes physical conditions that are greatly exacerbated by alcohol abuse. And in some cases, death itself caused by alcohol in the case of liver disease and so on. So we made behavioral health the prime focus, but we also wanted to hear about other things as well. What we found as we went around the state is that we've not yet fully recovered from the impact, I would call it the double whammy of the destruction of our behavioral health system that took place in 2014 when Medicaid, which funds so much of behavioral health, dropped 14 of the largest providers of behavioral health services in the state. It's been a slow go to restore that system after the Arizona companies that were brought in to take the place of the 14 companies here that were dropped from the Medicaid program after they left the state. I guess there's still one that's left, but most of the programming in the state of New Mexico had to be rebuilt. And that process has been going on, and we're getting close to having it restored. But in the meantime, we had the second half of the double whammy, which was the COVID pandemic, which made it really difficult for people to get to see their therapists, to get to see anybody who could provide behavioral health services, even at the moment that isolation occasioned by the lockdown became a factor in so many behavioral health problems suffered by New Mexicans, in the overconsumption of substances, and in the increase in domestic violence, all of which have been traced to the pandemic. So we're now in a situation where we've got money. The state is still benefiting greatly from the financial bonanza created by the oil and gas boom in the Permian Basin, and we want to spend it well. We know that behavioral health and healthcare generally is something that we need to put more emphasis into, but I want to outline for you some of the problems that we're facing as we do that. The first is that we rely on Medicaid for almost everything that we do in the healthcare system. We're spending now probably $9 billion a year on healthcare through the state in New Mexico. That's Medicaid largely, but it's some non-Medicaid activity as well. We rely on Medicaid because it's such a wonderful matching ratio. We put up $1 and the feds put in 3. What's not to like about that? And yet there are a couple of problems with it. First, not everybody is eligible for Medicaid. Not all the providers in the state who want to provide services are certified to participate in the Medicaid program. And the Medicaid plan doesn't cover all the services that people need. So we have to have something besides Medicaid to provide for the healthcare needs of the state, particularly the behavioral healthcare needs of the state. The other problem is that Medicaid is an insurance program. Basically, it reimburses treatment or the cost of treatment after it's been provided. It's not as good at starting new things. And so to develop new programs where we don't have any currently, we need to have something besides Medicaid in order to pay for those services, at least for a while, to get them up and off the ground. We need a more public health approach to initiating new programming. So one of the things we've talked about this interim, and we're proposing to the upcoming legislature, is that the third problem that we faced this summer was, everywhere we went, the shortage of behavioral health professionals, and how it's going to be very difficult, even if we raise the reimbursement rates for Medicaid, which is being proposed and which we certainly support. We want to get them up to at least Medicare levels, and if we can afford to go beyond that, we'd like to see them exceed Medicare levels. But even if we do that, we still have a shortage of providers. It's all well and good to be able to pay for something, but if there's nobody to provide it, we haven't really solved much of a problem. Now, admittedly, increasing the rates should retain some of the people in the state who might be tempted to go elsewhere because our reimbursement rates are so low. But we need to do something about just increasing the number of people in the state who are able to provide the services needed, both in the physical health realm and in behavioral health. So we're proposing several steps in this legislative session, one of which is to extend the tuition-free higher education program that we just started for undergraduate work to graduate programs in behavioral health, psychiatric nursing, counseling, social work, psychology. All of those now are fields that we need to have more people practicing in the state. And if we provided free tuition for the graduate level programs, with the proviso that if you accept this free tuition, you commit to working in New Mexico when you graduate, we think that would be a step that would be in the right direction. We think the community college, the undergraduate, the community colleges, and the branch colleges of the universities can all be expanded in their programs to get people into the pipeline. So that if we have community health worker training programs and peer counselor training programs developed at all of the higher institutions of higher education, we really could see a genuine increase in the supply of behavioral health professionals in a few years. We're priming the pump and hoping that in a few years we'll see those graduates either working in agencies in the communities, going on and getting their bachelor's degree or then their master's degrees and staying in these communities. But we also recognize that there are great programs being started all around the state that need support. And one of those are the crisis triage centers, the ones that have begun being created in Las Cruces, in Santa Fe, in Albuquerque, and other communities are looking at them as well. Places that can respond immediately to the needs of people living on the street or who are in desperate straits, and for whom simply counseling is not going to be an adequate response. So we want to fund those crisis triage programs around the state, and we want to come up with a way to encourage other communities to create their own versions of responses to those needs that can be funded by the state. To do that, I'm also proposing that we utilize our liquor excise tax in a more creative way than we have in the past. Currently, half of it goes to the DWI programs around the state, and I don't want to tamper with that. That's about 48 million going into DWI programs. The other 48 million currently just goes into the general fund. And what I'd like to see us do is use that, match half of it with Medicaid and create a $100 million increase in treatment. And the other half would go for non-Medicaid matchable services. So there's lots of needs. We have money. The trick now is to put them together. And I'm really eager to hear how the panelists are going to recommend we do some of that. Thank you very much.
Thank you so much, Senator. Those are exciting opportunities ahead, and we're looking forward to see how the session goes and comes up in just a short while. You guys are going to be really busy, we know. So I want to turn it over to Richard. Richard Eads is going to lead our panel today. For folks who don't know Richard, he is a Santa Fe icon that we all love and like to listen to here at KTRC. He's got about 20 years of hosting radio experience and also used to work in the political realm, so knows New Mexico well and some of the issues. So Richard, I'll turn it over to you so that you can kick things off with our panels.
Thank you, Carolyn. I appreciate being invited today by Molina. There's a lot that State Senator Jerry Ortiz-Pino that covered that we cover regularly here on the radio show. Just real quickly, some of the things that he mentioned, equity is a big issue. Obviously, access is a big issue. We talk a lot on the radio show about substance abuse, alcohol abuse, and that's not only from the illegal, but the legal that has been legal in the past over subscription of opiates, and then of course fentanyl, which is a scourge in New Mexico right now, killing many people. So a lot of those issues we will hopefully touch on today. I'm very happy to be here today. Let me introduce the panel. They are Antoinette Villamil. She joined the Sky Center, New Mexico Suicide Intervention Project in 2022 as the Director of Grants and Fund Development. For the past 15 years, she has worked in community and education-based nonprofits across northern New Mexico. With an MFA in creative writing and poetry from New Mexico State, Antoinette has also taught high school and college level writing classes, most recently at IAIA and New Mexico School for the Arts. She currently serves as a county-wide member of the Santa Fe County's Health Policy and Planning Commission. In 2020, Antoinette was named one of the 10 who made a difference by the Santa Fe New Mexican for pivoting the work of Many Mothers, organization that we feature here on the radio station, to address the needs of families affected by the COVID-19 pandemic. During her 10 years executive director at Many Mothers, from 2018 to 2022, Antoinette led the organization to adopt a new mission focused on health equity. She is a proud parent of a lively third grader and enjoys hiking, reading, practicing yoga, collecting pets, and being outside. Another panel member today is Jody Jepson, also with an organization that we like to feature here, the Santa Fe branch of Heading Home. She is the housing director of Heading Home, which is creating meaningful pathways to housing and services to the most vulnerable individuals in the community. Jody was born and raised in Albuquerque, received a bachelor's of arts degree in psychology and exercise physiology and leisure science with an emphasis in coaching in 2001 from Adams State up in Alamosa, Colorado. Since that time, she has dedicated her career to impacting the marginalized and forgotten populations in our society. Jody developed and implemented the Albuquerque Street Connect program, a division within Heading Home that serves individuals that are most at risk of dying in our streets. Last but not least is Dr. Joe Anderson, currently Assistant Dean for Cultural Affairs and an Associate Professor of Pharmacy Practice with the UNM College of Pharmacy and an Associate Professor of Internal Medicine at the UNM School of Medicine. He's been employed by UNM College of Pharmacy since 1999, where his area of practice is cardiology, and he's licensed as a pharmacist clinician. His research interests are cardiovascular pharmacotherapy and health outcomes, particularly as they pertain to advanced pharmacist practice. He served 2 terms, each 10 years, 10 years total, on the New Mexico Board of Pharmacy, representing the Central District of New Mexico. Dr. Anderson was recognized by the New Mexico Society of Health System Pharmacists as the Hospital Pharmacist of the Year in 2005. Those are our panelists today. As Carolyn stated, access and equity are big deals in New Mexico. And of course, there are many factors, and a lot of those factors became a lot more apparent at the beginning of COVID. Some of those are, as the state senator mentioned, the acute caregiver shortage. He told me recently, we were talking about substance abuse issues, that there's one facility in Albuquerque, they cannot even open a wing. They have the beds, but they can't open a second wing because of lack of staffing. Those who care for our elderly populations and those living with disability. According to Paraprofessional Healthcare Institute, between 2016 and 2026, a decade, it's projected that there will be over 75,000 job openings for caregivers in New Mexico. Yet, with 64% of current caregivers in or near poverty, recruitment and retention are difficult. According to the U.S. Department of Housing and Urban Development, over 3,300 New Mexicans are experiencing homelessness on any given day. 3 years ago in 2019, New Mexico had the 3rd highest poverty rate in the nation. 18.2% of our residents living in poverty. That's according to the New Mexico Department of Workforce Solutions. These are all issues that directly affect access to care, and today we're going to speak with those working tirelessly to find and implement solutions. Jody, you work with some of New Mexico's most vulnerable populations, those experience homelessness. Can you tell us more about some of the factors that prevent the unhoused, the unsheltered, from receiving quality health care?
Hi, thanks, Richard. Specific to receiving quality health care, specifically to the ABQ Street Connect model, we're data driven. And so it's really important that we're able to, really evaluate the data within the work that we are doing day in and day out. And the evidence really supports the psychiatric and medical services show resistance to providing care to individuals with serious behavioral health and the substance abuse in medical care. There's a bias against the vulnerable population. As difficult as that is to share the reality of that, that is the reality. And we have data that kind of can back that up. When we look at, for an example, somebody who's accessing in regards to the unhoused population, we can point a lot of fingers, but in reality, it's very complex. And so there's different entry points throughout the system. And that tends to be a lot of the emergency departments or the psychiatric emergency care, and even our Albuquerque Police Department, our first responders, right? And so once somebody is identified as a high utilizer, and I don't even really like that term much, but somebody that accesses the emergency departments or the medical world on a frequent basis, it's really unfortunate, but we've been able to show data that reflects just even in the care notes from the medical worlds in regards to a bias or not providing proper care to folks that have been identified as high utilizers. And this is very common, not only among the medical and behavioral health world, but also in the community where nonprofits serve folks who are unhoused. What's very, very common is folks are too difficult. They're too complex. They have behavioral issues that, or it's driven by drugs, but actually there's a primary behavioral health or medical need that's potentially driving those behavioral health issues. And so when we talk about receiving quality healthcare, this is a platform or a culture that we've really been focused on more, but at a macro level is how do we integrate and bring in MCOs and hospital providers, medical providers, behavioral health providers, and really start to look at changing the culture. And we'll talk more kind of about different solutions that we've been able to really identify to support these high acuity of folks where they can access care.
You laid it out well, Jody. Appreciate that. It is incredibly complex, not only from the issues that many of these people are suffering from, but the bias, as you state, in the community at all levels. Behavioral health, as State Senator Jerry Ortiz-Pino stated correctly, those issues are on the rise. A lot of that is pandemic related, especially now that we're transitioning, hopefully, out of the pandemic. New Mexico Department of Health found that over 8% of New Mexicans contemplating suicide did not have a routine physical checkup in 2020, nor did 13% of those who have been told they have a depressive disorder, or 13.5% of those who are experiencing frequent mental distress. Antoinette, how have you seen the pandemic impact access to behavioral health services? And what are some of the unique challenges our youth are facing during this time?
Yeah, no, that's a great question. Thanks, Richard. The pandemic completely changed access to behavioral health services. We saw that parents who worked, non-traditional or inflexible schedules had a really hard time accessing services. The single mom who works at Walmart can't easily take off at 10 o'clock in the morning, drive to a therapy session, and then get back to work. We saw a great deal of isolation amongst families, especially with the youth. We saw that finding a provider, as has been mentioned, became even more challenging during the early part of the pandemic as providers were overwhelmed with demand. Additionally, the government shutdowns created barriers until agencies figured out how to create online access. We know from talking to children and youth that many conversations happening in families' homes right now revolve around fear of the future. Climate change, increase in mass shootings, lack of affordable housing, soaring poverty, and inflation. These issues penetrate a young person's sense of hopefulness for the future. At the Sky Center, we've seen an increased, depression and anxiety in both youth and adults, and we see families struggling to find a sense of hope, purpose, and meaning. Since COVID began, children and parents have been more isolated, and adults have been less able to filter tragic news because they themselves have been so overwhelmed. When the last several years of the pandemic created community-wide fear of others, as well as intense loneliness and isolation, at the Sky Center, we're asking ourselves, how do we collectively repair and heal from that? We see an increased number of young people who are anxious to go to school, kids worried about parents leaving the house to go to work. We saw this, pervasive anxiety with the onset of the virus. We also see parents now who are anxious to send young people to school with assault weapons so readily available and mass shootings on the rise. So what do we do with all these challenges, right? How can each of us be a beacon of hope for youth again? We have to call on faith leaders, teachers, parents, and at the Sky Center, we specifically focus on family systems counseling. And so we introduce families to ways that can help them cultivate a growth mindset. We know, for example, that social connection is the remedy for depression. Self-regulation remedies impulsiveness. At the Sky Center, as a team, we're always talking about the ways we can make a contribution to change that pervasiveness of fear. And we're trying to give families tools so that they can access their inner strength and find that sense of hopefulness again.
Thank you, Antoinette. It's almost, you go through the litany of all of that, and it almost induces anxiety in me just listening to that. How do the adults, how do parents, how do those in what you work on, how do they exhibit that confidence that everything's going to be all right in the face of all this, so that the kids can see it?
Yeah, I think it's I think hope, the thought of hopefulness can be a little tricky. Because we don't want to have, this so-called toxic positivity. More than that, we're trying to, help families cultivate just a sense of growth and the growth mindset. Not that, we can't have this Pollyanna viewpoint, that everything is going to be fine, but you can have tools so that you can start to change your thinking. And so you're not so much focused on the problems, but what are the solutions? And that's what we're trying to do at the Sky Center. And that's what we're trying to encourage families to do. There's so many things we can't change, so let's focus on what we can.
Indeed. And I think we'll get back to that a little bit later in the show. And maybe some of the people who have tuned in have questions about that as well. Thank you, Antoinette. Appreciate it. Dr. Anderson, Joe Anderson, we know that many times, and this is true in my case, pharmacists, what you do, those that we go into and see in our drugstores are often the front line for those who are seeking medical care. Could you touch on the pharmacist patient care process and the collaboration between the patient, the family, their caregivers, and other healthcare providers?
Yeah, thank you, Richard. And let me first start by stating that pharmacists are arguably the most accessible healthcare provider, as 90% of Americans live within 5 miles of a community pharmacy. And since pharmacists are accessible, they can help provide critical access to care for patients with acute illnesses, such as COVID or flu, RSV, as well as provide assistance to patients and their primary care providers with management of chronic medical conditions, high blood pressure, diabetes, depression. You asked about the pharmacist patient care process, and that's how we train our graduates to provide care. And the pharmacist patient care process describes a real systematic approach to patient care that pharmacists perform, regardless of their practice setting, whether it's hospital or in a community pharmacy setting. And it consists of 5 steps. The first step is collection of patient information and data. After collecting that data, the second step is assessing the problem that the patient is particularly presenting with, or assessing the appropriateness of the therapy that's been prescribed to them by other providers, and really in the context of the patient's healthcare goals. And then the third step is creating an individualized patient-centered care plan that is in collaboration with the patient, their caregivers, their family members, as well as the patient's other healthcare providers. The fourth step is then implementation of the care plan in collaboration, again, with the patient, their caregivers, their family members, and other healthcare providers. And then the fifth plan and important part is following up with the patient to monitor the safety of that therapeutic plan, the effectiveness of that plan, and determining if there are any changes that need to be made in that particular therapeutic plan. At the center of this whole process is the patient. And it's really about empowering the patient, their caregivers, their family members, to be actively engaged in the healthcare decisions that are made. It's not a passive process. They have to be in sync and in agreement with whatever therapeutic plan is being developed. And so the process really emphasized team-based care with the pharmacist as an active member of the patient's healthcare team. Multiple studies have demonstrated that the inclusion of the pharmacist as part of the interprofessional healthcare team improves patient access to care. We heard Senator Ortiz-Pino talk about how critical it is we increase the number of providers that can provide patients with access. Studies show we improve health outcomes, and whether it be blood pressure control of diabetes, reducing hospitalizations, even reducing death, as well as all at the same time decreasing healthcare costs.
Let me ask you this then, Dr. Anson, and going off of what the state senator said, when we look at the issue in the pipeline and the shortages of caregivers, is there a pipeline, established pipeline from those community colleges, from those branch colleges, from the four-year colleges? Is there a willingness? Is there a pipeline? Is there a way to recruit? And how is that going when it comes to essentially when it just comes to people going into pharmacy?
That's a great question, Richard. We actually do have programs. University of New Mexico College of Pharmacy is the only college of pharmacy in the state. We're actually the oldest health professional program in the state, and we do collaborate with our other colleges. We have a cooperative program with New Mexico State, which the students there take prerequisites and then for the first couple of years, and then come up to Albuquerque where they're enter into a professional program. We have also programs with junior colleges, the other universities, Eastern New Mexico, Western New Mexico, New Mexico Highlands. We have what's called early assurance program. So students participating in those programs can take the prerequisites. There's 3 years of prerequisite training prior to getting into the doctorate program. And so we have early assurance programs in which students can voice an interest in pursuing the pharmacy career. We work with them. Our Office of Student Affairs works with them to give them a template of the courses that they need to get in. And so, in terms of support, we absolutely could use support with helping those students, guide those students towards a career in pharmacy.
Thank you. Appreciate it. Jody Jepson from Heading Home. Recently, Heading Home received a very nice grant from Molina Cares for Families initiative benefiting your Albuquerque Street Connect program. Can you give us a little bit more details about this program and how it is funding what you're working on your services that you provide?
Yeah, so talk a little bit about the program. A little bit about my background. I had worked with the Albuquerque Police Department as a crisis specialist for about 8 years, and then got back into the nonprofit world and at Albuquerque Heading Home the initiative. And it was really clear, having worked in the community and in different entities, that there is a subpopulation of individuals that as a community continue to fall through the cracks. And it was really important when identifying and creating this model that we figured out a way to really work with the folks that clearly who are the most acute in our community, who are unhoused and most likely to die on our streets. And so we're so thankful for Molina, the specific funds that we had received will continue to support our staffing efforts. Staffing is really key, and I'll talk about more about that later, but 73% of the staff, that the navigators, I refer to them as navigators, the team, they are out in the field 73% of the time. It's really important. And a lot of folks, I think there's misconceptions, or at least in the world that I live in, working with other folks, is we have these expectations of folks of showing up to appointments. And then what happens quite often when they don't show up on that third time, whether it's a medical appointment, which is very common, or appointments to receive a housing voucher, they're actually dropped from their panel, or they are dropped in receiving that housing voucher. I think that's really important to note, because these are individuals that have some form of a severe disability, level of cognitive functioning that they're not able to navigate not only their own personal environment or themselves, and some not even able to manage their own adult daily living skills, who are living on our streets. They're just not able to navigate, and it's very common that people continue to fall through the cracks, because as a system, we do have these expectations of serving folks. And so it was really critical that we look at a program and a model that we walk with folks. When I say we walk with them, there's a common thing we don't do for, but I have to state this, is that we have to do for and walk with folks to help get their basic needs met, whether that's fast track to medical, fast track to psych, housing, food, basic needs. And so the funding really has allowed us to continue to staff up and make sure we get the best folks in here to continue to walk with the folks that we serve, the most complex folks.
Thank you, Jody. It seems like it's just an enormous task and responsibility. Appreciate you sharing that with us. We here in New Mexico experience some of the highest youth suicide rates in the United States. And here on the radio station, we work with other organizations, other nonprofits that work around the gun issues. Very, very critical to that, because they interface with a lot of youth who are contemplating suicide, which is why organizations like Antoinette and Sky Center are so vital to our community statewide. Antoinette, can you tell us a little bit more about how Sky Center, your organization, is working to promote mental wellness and care among these populations, especially the youth who face barriers in access to care?
Sure, thank you. Well, while our mission at the Sky Center is to reduce depression, anxiety, and the risk of youth suicide, we do not focus on despair. And I have to say, as someone who joined the organization just in August, that was hard for me to wrap my mind around. But that's one of the beautiful things the Sky Center is doing. We're cultivating hope, connection, and life skills so that young people can manage the many challenges of today's world. We like to think that our work helps youth and their families learn how to surf through challenges, right? Because we all know the waves are inevitable. Last year, as an example, we worked with a young teen who was questioning his sexual orientation. He was cut off from his family, but he found safety and support with his grandmother after several months of family counseling with her. She was able to say that really sticky stuff, that kids need to hear that keeps them close. She once said in a session to him, "I love you no matter what, and nothing you do could ever change that." The Sky Center serves nearly 100 families per week with no cost bilingual behavioral health counseling, which fills a tremendous gap in care here in northern New Mexico. In the past year, we provided nearly 1,500 children, teens, and parents with 12,000 hours of no-cost services. We see all the vulnerabilities that families are facing. Our population is generally poor, with parents working multiple jobs, working nights. Many have no health insurance, and many are facing unstable housing. But our hybrid model has increased access, so families can come in person or they can meet over Zoom. And our sessions take place after school and in the evenings, so families have access during non-school hours. In addition to the family counseling program, we also offer a number of other services. We have intensive outpatient services and 24/7 response to youth that are referred by Christus St. Vincent Regional Medical Center's emergency department. We have a group skills curriculum at Santa Fe school sites to increase youth emotional resources. We have a gatekeeper training for adults who are in a position to recognize and respond appropriately to youth showing signs of depression and suicide risk. We regularly provide classroom suicide prevention presentations and education to the schools. We have a natural helpers program, which is a peer helping program, and that's provided to middle school youth to create caring school connections and a safe, inclusive community at school. We also have mindfulness education seminars for teachers and students. For the teachers, we really aim at decreasing teacher burnout, classroom behavioral issues, as well as increasing success for students. We organize Northern New Mexico's post-vention crisis team, which provides support to school communities after student suicide or other traumatic event. And finally, we have graduate and advanced studies training that increases the number of behavioral health professionals in Santa Fe County who have the skills to diagnose and treat adolescent depression. So that speaks to that the workforce training that the senator was speaking about earlier.
Wow, thank you. I appreciate that, Antoinette. We talk about isolation. We talk about kids being on their own. We talk about lack of access. We talk about those in rural New Mexico, those in tribal areas, and the lack of access. It takes your organizations, all of you that we're talking with today, and including other organizations we'll have on today, communities and schools. They do an incredible as kind of a buffer between the educators, the teachers, and then the students who are suffering. Then there's other organizations here in town like Gerard's House that do amazing work around grief. Appreciate it, Antoinette. Thank you very much. Dr. Anderson, back to you, if you don't mind. Apparently, there's also a shortage and an inability to access medication in New Mexico. Why do we have this shortage in medications and medicines, and what can we do to either mitigate or alleviate that?
Yeah, thanks, Richard. Great question. There is no question that med shortages are a significant public health threat. Unfortunately, the shortages, while they've decreased since 2011, they're still occurring. And they result in delays in some cases in critical life-saving medications. And in addition, they're a major source for potential medication errors as providers are having to change to therapies that they may not be as familiar with. Pharmacies are having to dispense medications that in many instances they aren't as familiar with either. And it was just recently in October, the National Community Pharmacists Association surveyed over 8,000 community pharmacists to ask about drug shortages, and 98% of the respondents said they were currently experiencing a shortage of medications. And specifically, and some of you have heard of this, but 89% indicated they're experiencing shortages of Adderall, which is a medication used to treat mental health disorder, ADHD, attention deficit hyperactivity disorder. And then importantly, as we entered winter season here, 66% indicated a shortage of amoxicillin, a very common antibiotic that, you know, we've all probably taken at some point in time. And so to your question, what can be done? Well, it really does take a national effort, and the Food and Drug Administration nationally takes the lead role in addressing these drug shortages. And it's really what they do is based on the cause of the shortage. So, for example, if the shortage is due to manufacturing or quality control issues, well, then the FDA works with that manufacturer to address those issues and hopefully correct those issues as soon as possible. They may work with other manufacturers to help them to speed up their manufacturing lines to produce more of a particular medication that's shorted. Or in some cases, if they're not producing that particular medication, maybe working with them to start producing that medication to make up for another manufacturer's issues. They also receive information early from manufacturers who are anticipating the drug shortages. And then this information is communicated on the FDA website so that pharmacies, patients, other healthcare providers are aware and can anticipate these drug shortages prior to their becoming a critical issue. Now, in order to mitigate these shortages in the future, a coalition of professional organizations, the American Medical Association, the American Society of Health System Pharmacists, the United States Pharmacopoeia, and others, put forth several legislative actions that are necessary. And one of them, the first, is to incentivize advanced manufacturing technology and develop new manufacturing technology for critical drugs and what's called active pharmaceutical ingredients, or API. It's startling to know that only about less than a third of API, active pharmaceutical ingredients, are actually manufactured in the United States. So the majority is manufactured in foreign countries. So this really represents a national threat regarding drug shortages. Two is to improve the function and composition of the strategic national stockpile. We're aware of the strategic reserve for gas and oil, but there is a strategic national stockpile for medications, and that came to light during COVID. And so, for example, we need other medications in that national stockpile. We need testing agents, administration agents, syringes, things like that need to be included in that strategic national stockpile. And then third, improve multinational cooperation on supply chain resilience by enhancing international cooperation and collaboration with foreign supply chain partners, including, but not limited to, foreign governments and manufacturers. As I mentioned, majority of medications being manufactured outside of the United States. And then what can we do locally? Locally, hospital or health systems can create and should create drug shortage subcommittees that can help to anticipate and develop solutions to a drug shortage by managing the available resources. What's critical with drug shortages is communication as well as collaboration between all members of the healthcare team. So it's very essential to make everyone aware of these potential drug shortages, and then what are the alternative treatments so that errors don't happen. And then obviously communication has to occur with patients and caregivers so that they're aware. What can they do? What are these new alternative therapies, and how are they supposed to take those? But it is a critical issue right now.
Sounds a little bit like the shortage of baby formula.
That's right, somewhat.
Are there informal, you said create committees, formal committees, communication between large healthcare providers, UNM, the big healthcare providers in Mexico? Are there I mean, are there systems set up so that, one can call another and say, hey, we're short on this. Do you have some? Can you help us provide this medication?
Yeah, that's a great question. Health systems, hospitals, et cetera, they do often communicate with one another, and obviously within a healthcare system, they have strategies, committees, as I mentioned,
Right.
to help deal with that. But oh yeah, that's very common where we'll see health systems, trade more or less back and forth medications when they have shortages. There are also something called outsourcing pharmacies that can actually compound medications for batches, larger batches of medication. You're probably familiar with compounding pharmacies, but those can only make medications for a particular patient. But these outsourcing pharmacies can actually compound large batches of medications and then distribute them. And sometimes hospitals will work with outsourcing pharmacies to obtain, some of the IV fluids that have been shortaged or injectables that have been shorted.
Drugs that are made overseas, real quickly, doctor, or is testing adequate
Yeah,
for purity and quality?
yeah. I mean, most, all the medications that are brought into the United States, the manufacturers at least have to submit to regular FDA inspection. Otherwise, the FDA wouldn't approve them to be in manufacture to manufacture medications for our drug supply. That's part of the questions with reimportation of drugs, is that you sort of bypass that FDA inspection step. And so if you're getting reimporting drugs from, for example, Canada, we might not have that safety inspection step. However, Canada has its own inspection and safety steps too that they do. So that's another topic.
Appreciate it, doctor, very much. Question from one of the people watching: what options are there out there for crisis help when there is an immediate behavioral health crisis? Jody, let's start with you. What options are out there?
Sorry. Well, now we have the ACS program with the city, so I would definitely encourage, I work more with the unhoused population, but if there's somebody who's housed with the behavioral health crisis, definitely you need to call 911, and the dispatch there does an amazing job of screening and prioritizing those calls to make sure that they get the right resources out there to support those folks who are in crisis. So that team and that unit is doing great work in those regards.
Crisis for options for crisis, Antoinette?
Yeah, I know there's a new national 988 number. Santa Fe just launched. I think it's called the Alternative Response Unit, where if you call 911, they'll send a team of social workers. I mean, not necessarily police out. And then the ERs, and then specifically with youth, when youth are transported to Christus St. Vincent Youth in Crisis, the Sky Center is called, and our team 24/7 will send social workers and counselors to work directly with the young people in the hospital.
What do you know about the Santa Fe County Triage Center for mental and behavioral health?
I don't know much about that.
Okay,
Sorry.
we'll look into that. Doctor, do you have any comments on options for crisis treatment?
No, not any in addition to Jody and Antoinette. No.
Well, that was the only question that, let's see, I've received so far from those listening. I appreciate the work of all the panel. When we talk about things that we can do, issues that we need to address, steps that can be taken, we just at the beginning of the hour had on a state senator who is very familiar with a lot of this, the systems that work, the systems that have been broken, especially post the previous administration when they dismantled mental and behavioral health care. Jody, let's start with you. Do you have access? Do you have somebody to advocate on your behalf to the legislators?
We've really, having the opportunity, that's really been a priority of mine this past 6 months, more of a macro kind of level of systems. I'm working with Ane Romero from Senator Ben Ray Lujan's office. I'm actually working with an ombudsman team right now. This is not a lot of people are probably aware of this, but in the population that we serve here at Street Connect, probably 80% of the folks are referred as red line from our state care facilities. And this is specifically due in the denials. It's based on their behavioral health. And I don't know if a lot of people are aware of that, but we're going to take a look at that deeper. It's just not acceptable. And so I have just kind of aligned with some folks to really help take a deeper dive into that. And it needs to change. Specific around that.
Indeed.
So,
Well, that is coming up, 60-day session, and hopefully a lot of these issues will be addressed. Jody, thank you. Thank you very much. I want to thank you for participating today. Antoinette, Emil, thank you very much. And Dr. Anderson, thank you. That's about all the time we have. We're going to turn this back over to Melina and Carolyn Ingram.
Thank you so much, Richard. Thanks again, everybody, for joining us today. And thank you especially to our speakers, our keynote, Senator Ortiz-Pino, and to Antoinette and Jody and Joe. Thank you so much. And Richard, to you for joining. Really appreciate the insights. For people who weren't able to be on, we're going to be recording it and then posting it, or it is recorded, I guess I should say. We'll be posting it so people can share the information later. And we look forward to continuing the conversation, in the days ahead. And Senator, we really look forward to seeing what comes out of the next legislative session. So thank you so much, everyone. Have a good afternoon.